A woman came to see me, and her wife is a patient, and she was sent to me by pain management to get electrodiagnostic testing. She had pain in her legs, and they wanted to do Minuteman fusion. They wanted to do a fusion surgery on her spine. And before the fusion surgery, they just wanted to get nerve testing. And the MRI of her lumbar spine didn't really reveal anything concerning. There was some mild what's called spondylosis, which is degenerative disease, without any significant impingement on the nerves. No foraminal, which is the little hole on the side of the spine, no foraminal stenosis, which is narrowing, and no central canal stenosis of any significance. So MRI looked fine, and the plan was to have her get a fusion. She had received 4 epidural steroid injections and I think facet blocks, and none of that had worked. That's what had happened so far, because she had tremendous pain. And here's the pain story. So the pain she had was really not present in the day, not really there with walking, definitely not exacerbated with activity, and it came on at night when she lay down, and it was the worst in the middle of the night. It was symmetric on both sides, and it was the front of the legs on both sides, started at the knees, went down to about the level of the ankles, and it felt like the skin was being ripped off of her legs. It did improve with movement. Movement made it a little bit better. It did make her get out of bed. She didn't have a sense of needing to get out of bed, but she would do it because she was in so much pain, and that would help a little bit. That's the story. And her exam was normal. She had a normal neurological exam. Now, that story and that exam is not, I would not say it's not 100% pathognomonic. Pathognomonic means if you hear this story, then therefore this is the diagnosis, right? This is not pathognomonic, meaning it's not absolute, but it's awfully close to that for restless leg syndrome. Restless leg syndrome is very typically diurnal, and it's very time-locked, and that specific dysesthesia of the skin ripping off your bones is uncommon for a radiculopathy. The idea that this woman was going to get a fusion was appalling. The idea that this woman had had epidural steroid injections was appalling. So we gave her benzodiazepam, and her pain disappeared, which is what happens with restless leg syndrome. Benzodiazepams do not make the pain disappear with any kind of nerve root problem.